Now to our GMA cover story, shining a light on long COVID in communities of color. According to a recent CDC report, 1 in 14 Americans has had or is still battling long COVID. But according to a story we first saw in the Washington Post, getting a diagnosis or even help can be challenging, particularly for people of color. Early in the pandemic, Jasmine Holcomb got a bad case of COVID and wasn't able to breathe on her own.
I told my mom it's time for her to go on the vent, and there weren't any other options at that time.
For 2 months, the 28-year-old from Baltimore lay on a ventilator in a medically induced coma.
One hand on the...
Miraculously, she pulled through.
1, 2.
Yeah.
Good. But she had to relearn how to walk, how to talk, and how to deal with the chronic condition known as long COVID.
Long COVID is when there are any sort of signs or symptoms or any sort of conditions that start after a COVID-19 infection and then persist onwards.
Long COVID occurs in 10% of all COVID infections, and more than 200 symptoms have been associated with the disorder, from gastrointestinal problems to changes in blood pressure and heart rhythm.
The most severe long COVID patients that I have right now are homebound.
While long COVID can happen to anyone, most diagnoses are in women aged 36 to 50. People in the prime of their lives, like Janine Hayes, a New Yorker diagnosed in 2021 at age 42.
I want people to know that we're not making up our symptoms, that we have real complex issues, and that it is extremely hard if you're African American, because you come in with complicated issues into a healthcare system that is not designed to meet our needs.
Studies show that Black and Hispanic Americans may experience more health problems related to long COVID compared to their white counterparts, but are less likely to be diagnosed and get proper care.
Communities of color and underrepresented communities have difficulties with access to care. They're underinsured, they're uninsured. So that first big barrier of even encountering a physician that suspects long COVID that will refer them doesn't happen.
Medical bias is also an issue. Before her long COVID diagnosis, Janine says she went to an allergist for her hives and said the doctor, who was white, diagnosed her with herpes.
I was like, I just don't think it's anything like that. And she just kind of rushed me out. Like there was just really nothing to it. I can't believe that this appointment we had waited for and the outcome was being dismissed, really not feeling like I was heard in any way at all.
Janine says she ultimately found excellent doctors. Jasmine says she was fortunate to have her mom, a former ICU nurse, advocate for her in the hospital when she couldn't speak for herself.
I was able to have a good advocate on my side for a lot of these things, which in general, most people don't have, let alone people of color.
But hospitals across the country are trying to address issues of bias and access to care for minority populations.
There's a conscious effort from the advocacy groups for long COVID to make those voices heard, which I think it's incredibly important.
Mount Sinai Hospital is addressing this problem by expanding their Center for Post-COVID Care into the hardest hit areas of New York City, East Harlem, and the Bronx.
The reality is that there's a lot of undiagnosed patients out there and so many patients who just don't realize that all of this is happening and linked to their COVID infection and that there's options available to help them feel better.
Yeah, it's good to know there are options out there for those who are suffering. And as for Jasmine, she's improving every day and recently felt well enough to attend a Beyonce concert. And she says, quote, "God didn't bring me this far just to bring me this far," end quote. But what a story.
It sure is.